for the senior person. So what is Medicare? So the Medicare is a health insurance for 3 groups of the people: citizen or the permanent residents provided by the federal government. So what are 3 groups? One is 65 and older senior person. Another one is under 65 with certain disabilities. And the third one is early age with end-stage renal disease. So if these 3 groups you are qualified, you can get the Medicare. So the who handle Medicare actually is this department called the Centers for Medicare and Medicaid Service. That's their side. When you see this one, you know they are take care of the Medicare. So the Medicare, this one is a Medicare card. So when the people have this card show up, you can see they have the Medicare. So how Medicare is funded, that's very important. We should to know. So Medicare is huge. It costs huge money, and the resource is from these 7. One is the general revenue, most is government. They pay for that. So the payroll tax. So if you pay the American tax, you will see in your payroll tax, the employee always pay 1.45%, and the employer pay another 1.45%. And as our self-employee, we need to pay 2.9% our salary for the Medicare tax, and no cap. No matter how much you make, you always pay. But for the high income earner, like if the couple they make the quarter million, their Medicare tax will go up to the 3.8%. It's higher. And also Medicare is not free. Also we need to pay premium and taxation of the Social Security benefit, because everybody know we pay a lot of the payroll tax, the tax so for Social Security, and they do this investment, so the benefit and the transfer from a state, other revenue something. So that's the total one. But when we say the A, we can say Part A, 90% of Part A is paid from the payroll tax. So that's the reason if you are qualified the Medicare, you already earn the 40 points, your Part A premium will be free. But the other one, most is paid by the government revenue. So that's the other parts we have to pay the premium, called the co-insurance. So in Medicare, they have the 4 parts. The first one is Part A, called the hospital insurance. Part B, Medicare insurance. Part C, called the Medicare Advantage Plan, like the HMO and the PPO. And Part D is called the prescription, the drug coverage. So what's the Part A? So the first Part A and Part B is managed by the Medicare service. So when you sign up, Part A, Part B is mandatory. When you qualify, you must sign up Part A, Part B. That's the mandatory. So the Part A called hospital insurance. So this one, most people receive the Part A premium is free. If you paid the medical tax and at least 10 years, your Part A, you don't need to pay the premium. But you also need to pay the deductible and something. So if you paid FICA less than the 10 years, but you still want the Part A, you need to pay premium. So the premium like this is $485 per month after you're 65 years old. And here is Part A, very important that we should know. Part A is hospital insurance, but from the day, if you stay in the hospital, day 1 to day 16, you have the deductible. Each time you go to the hospital, you need to pay this deductible. 2022 deductible is $1,500. So that means the day 1 and to day 60, your cost will be $1,556, right? So after 60 days, 60 to 90 days, every day you need to pay $389. That's for this year. But after 90 days in your whole life, you have the one time you can extension to another 6 days. That means the day day 90 to 151. That's only lifetime. You only have one time you can extension. So, but you still need to pay per day. You need to pay 778. That's a lot, right? You think that's a lot. Actually, this price compared with the real hospital charge still much less. You know my husband this year he stayed one night in hospital. Can you believe how much is 10,000? One night is 10,000. So they only charge you 778 per day by yourself. Still is much cheaper, right? So after beyond 151 days, you need to pay all of this. That means maybe the 10,000 per day. So you can calculate how much you have. So that's the part A. So a lot of people have the myth. They think the Medicare will cover all the hospitals. No, they have the limitation. So what is the part A covered? They cover inpatient hospital stay, semi-private, just like some meal when you stay at the hospital. They cover everything. They cover skilled nursing facility care. They cover home health care service. That means after you discharged from the hospital, but you still need the nurse or the part-time or intermittent skilled care, and the professional can come to your house to look after you. Let's cover this. And the hospice, and also the blood. If you need blood in hospital, the part A will cover this. So in the part A, when you go to the Medicare website, they already said Medicare and most health insurance plan, including the Medicare supplement insurance, Medicare, and policy, don't pay for this type of care, what's sometimes called custodial care. So that means if you need somebody help you do some routine stuff like the bathing, eating, dressing, the help you walking, everything, this Medicare doesn't cover that. That's called custodial. So that's why the government encourage everybody you need to buy the long-term care insurance. So that they have the website, long-term care, gov, you need to buy this. Here is the long-term care cost. That is not update, right? That's the already old. You can see, so the nursing home, so the private room, 1 year, almost $100,000. I know the currently in San Diego, the private nursing home already costs $10,000 per month. So the reason I talk Medicare and Medicaid is because we don't do the Medicare, Medicaid, but we can help people get long-term care. So we need to educate our client. A lot of people, they don't understand that. We should ask them, consider the long-term care. That's the reason today we talk about the Medicare, Medicaid. So another one, continue. So I need to do this because they cover. So Medicare Part B coverage. So this one, Part B coverage, is doctor service. Just when we see the doctor and do all the examination, this Part B. For the Part B, we don't need to pay the premium. Yes, Part B, we do need to pay the premium. That's called the insurance. Everybody need to pay premium, and also we need to pay 20% copay. So how much the Part B we should pay? So the Medicare Part B coverage I will talk about, the most is just the diagnosis, see the doctor, everything. And the Part B coverage like this. I don't want to go through the details because I don't have enough time. You just remember Part B, just the normal when we go to the hospital, we see the doctor, we do all the checkup, and also we need to get some equipment like the oxygen tank, something, and stay home. And the other one is Part B coverage. So here is Part B Medicare premium. So for 2020, every year the premium is go up. So this year, if individual your tax income below the 91,000, and you need to pay $117 for this Part B premium. So if you make more, you will pay more. Look, if your salary, if your income, tax income is over $500,000, and each person every month need to pay $578. So that's the premium. And Part D we call the drug coverage. So the Part D is it's Part D or the PDP. So a lot of people with Medicare provided through the Medicare prescription drug plan, Medicare Advantage plan, and other Medicare plan. So what do the Part B plan cover? So just cover all the some of the prescription. So from the A, B, D, I just before I told about in the Medicare we have the 4 parts, Part A, Part B, Part D, right? So this A, B, D is mandatory. When you sign up Medicare, they require you to sign up the A, B, C, D. But the D, Part D is not, this insurance is not provided by the Medicare. CMS is not provided by them. It's provided by the private insurance company. Of course, this private insurance company already approved by the Medicare organization. So this one. So the Part D, you also need to pay premium. It's not free. The Part D, like this, as if your tax income is below 91,000 or less, and you need to pay premium. So how much your premium? You need to sign up with the private insurance company and get the premium. So that's why you need to pay. And also, after your salary is the tax income is up 91,000, and you also need to pay this money, like this $12 for the Medicare organization. That's the thing you can see. If your income is over $500,000, and besides your Part D plan premium, you also need to pay $77 for the Medicare. So the Part D, and also this is called the co-insurance, but when you get the drug, you also need to pay your copay. So I don't want to tell the details because a prescription is very expensive, and you can up to, if you have so many the prescription drug, every year your cost can up to the $8,000 out of a pocket. So this year, if your out of pocket, the money is, I think it is 7,900. So after that, government will pay for everything, but you must pay 79 out of your pocket for the copay. So then I want to summarize. So what are the parts of the Medicare? Medicare actually is Part A, hospital. Part B, Medicare insurance, and Part D, and prescription. That's the provided by the Medicare insurance. But after you see this, you found something miss, right? There's no vision. The vision insurance, no dental, and the cost is high. So in order to solve this problem, so government Medicare and allow some the private insurance company to provide what's called a supplement. So that's why we call the Medicare Part C or Medicare gap. So this program is provided by the private insurance company, and this is the two program. One is called the Medicare Advantage. One is called the Medigap. So what is it provided? So this is very complicated, right? So actually this all the plan you can customize. So when you sit down with your private providers, and you can choose which one you want. The more cover, the more expensive, right? So that's all of this. They have the HMO, they have the PPO, they also have the customized called the TSA, everything. So you can choose whatever you want based on your health situation. If you are not health, you always need to see the doctor. You want to lower your copay, maybe you will choose the supplement. We call the supplement Medigap, like this one. And another one, say they have so many plans. For the Medicare, they have the A, B, C, D, E, F, G, all the plans. So every plan, they have their content coverage. So you can choose. So I don't want to tell the details. So when you need this one, you need to sit down with the professional Medicare person to go through all of this. But the things you need to remember, this pre-insurance is provided by the private company, and you need to pay for the premium. So another one is called the Medicare Advantage. So when you're shopping the Medicare, you can go the two ways. The first way, you sign up government Medicare, and you get a Part A, Part B, go through the government. And step 2, you need to choose Part D, and also you sign up Part D, and you choose the Medicare supplement called the Medicare. I just mentioned that. You can choose some of the Medicare planning and combine together, get the completely health insurance. That's the one way. Another way, you just go to the private, the Medicare insurance provider, which is approved by the government. Just do the Medicare Advantage plan. This plan already combined with A, B, and D, and you also can make your personal plan go through it. You cannot do the both. You cannot say, oh, I bought the Medicare and also go through the Medicare Advantage. No, you only can do the either this way or this way. Okay, so for the Medicare, I just want to summarize, right? We have Part A, Part B, Part C, Part D. So that's the 4 parts. So how Medicare enrollment? So when you reach your 65 years old, you need to sign up for the Medicare through the Social Security website. And when you can sign up, is your birthday, 65 birthday, before 3 months your birthday, also after 3 months your birthday. You totally have the 6 months window. You can sign up. If you don't sign up, there's the 10% penalty. So you need to remember, when you reach the 65, sign up, get the part A, Part B. So what's the Medicare Advantage open enrollment period? Just if you want to get Advantage, so usually it's January to the March, or individual if you set up the Medicare and the first 3 months enrollment in Medicare Part A and Part B. So you need to remember that, right? Another one is when is my special enrollment period? So this one is somebody, if you are reached 65 years old and you still working for the corporation, you got the company insurance, you can delay. You can delay the Medicare enrollment. They allowed you delay. But once you retired and you lose your health insurance, you need to sign up the Medicare immediately. So the window is 8 months. The 8 months after your coverage ends for Part A, Part B, so you need to enroll this, the Medicare. Okay, so I finished the Medicare part. Now I'm talking about the Medicaid. You know, a lot of people, when I meet the client, they always said, oh, you said the Medicare doesn't cover long-term care. I saw a lot of people, the government provide long-term care. Yeah, what's the difference? So the government also provide another health planning called the Medicaid. Medicaid is a federal state health insurance program. Most costs covered by Medicare and Medicaid. Eligibility determined by the state, and the application process and the benefit is different. Every state is different. Basically, this Medicaid is provided by the low-income people. So who can apply for the Medicaid? So 65 years old or older, a child under 19 years pregnant, living with a disability, a parent, or the adult caring for child, and adult without dependent children, and eligible immigrants. This one, they don't need the green card. They don't need you are the citizen. The immigrant, you still can apply for this. In most states, more parents and other adults can get cover, qualify this. So the Medicare, this looks like in California, they also call the Medicaid, right? They look like this. So who can, so this is the cover. So in California, you know, the 19, yeah, I didn't get the latest, in California, Medicaid program income eligibility. That's the 2019. I think this year they may be a little bit higher, but still is very low. If your 1% income is below the 16,000 per year, and you can apply for the Medicaid. So that's the income for the family size. You can see most people is if the two person the family, your income is below 22,000, you can apply for the Medicaid. Medicaid is cover everything. I just talk about the Medicare, they cover something. You also need to buy the supplement. But for the Medicare, you don't need to buy anything. They completely coverage. And it's completely free. You don't need to pay anything if you are qualified. You don't need to pay the copay. You don't need to pay the co-insurance, and everything is free. So the annual income for the state, for the federal, is annual income must be below 133% of national poverty level. California is a little bit higher. If your annual income is below the 138%, the poverty, you can qualify. Oh yeah, here is latest. Here is the latest, the national poverty and California. If you are qualified for the Medicaid, you can apply for that. So another one I want to clarify. A lot of people said, okay, I qualify for the Medicaid. Do I qualify the long-term care? Because the Medicaid provide long-term care, but in the long-term care, they have their own requirement. For most states, if you apply for the Medicaid long-term care, you must is 65 years old or above, and your income limitation is the 2,523 23 per month for this year 2020, and they have the income limitation. This income including everything, including your social security benefit, your rental, your interest, your capital gain, everything. They come together. That's your income limitation. And also your totally assets limitation is 2,000. So but for the people, if you have the primary residence, you only have your one primary residence, they have a requirement too. For the house, if you have a rental, definitely you are not qualified. You cannot qualify for this long-term care because they have the assets limitation is 2,000, but the government allow you have own the one primary house. But for the most state, they have the requirement for the house equity interest. That means your house equity. What's that mean? If you buy the house is $20,000, but now they are reach the 1 million. That means your equity is already over the $63,000, like that, and you are not can qualify. So they call the house equity is from the 633,000 to the almost 1 million. That's the limitation. But in California, there's no limitation. So the California is okay. So no matter how much house the price is raised, you don't need to pay anything. Yeah, you still qualify the long-term care, the service, as long as your salary, your income is below the 2,500, you still qualify. So just I mentioned, okay, my time is almost up. So I just mentioned the Medicare and the Medicaid. For most of us, we only qualify in the future when we retired. I think most of us, we only can apply for the Medicare. For the Medicare, we already know we need to pay a lot of premium and copay. And also the Medicare, they don't cover long-term care insurance. So that's why we need to educate all the clients and tell them, because I know maybe the 60% of the client, the people, they have no idea. They no idea the Medicare doesn't cover the long-term care. So we need to educate client. And also we need to offer the solution to bridge the gap by meeting one of the professionals. So another one is that each individual has a different case. So it's important to plan. So when you want to apply for the Medicare, and you need to really sit down with the Medicare professionals to choose the best and suitable the health insurance for yourself, because it's very complicated. If you want the more coverage and like the Medigap and the Medicare supplement advantage is very complicated, because I start a little bit, I already confused. Maybe we need to ask outside. I know he sells the Medicare insurance, right? You can tell us the details. It's very complicated. I think that's my